Kant has described that is what the perfect science is, but we are partially knowing it because we lack the knowledge, and the way we are diving inside, it is like an ocean. The more we dive, the more we get. So this is what Kant has also mentioned. My objective of today's session is understanding the evolution of PCOD and PCOS. Don't worry, it won't be only a session based on PCOD. We will be helping to understand the importance of evaluating the PQRS and how understanding the totality of symptoms and individualization in PCOD cases will help you to evaluate these cases, and definitely correlating the emotional pathology of PCOD and understanding struggle, what a female goes through the identity conflicts in her lifetime so that she develops the disease like PCOD or PCOS or other hormonal issues. The physicians, this is what I always begin with as a prayer. We always begin with a good positive notion and a good positive thought. So this is the first aphorism where we are trying to understand that we are on the mission of curing the sick health. So it is not only the mission of curing. I've already. Can anyone help?
It's clear from our side. It must be some problem with the delegate side. Please continue.
Yeah, I
ma'am.
don't.
Please
Can
continue.
you hear?
Yeah, I can hear you clearly.
Fine. So this is where we have to understand what the sick means. So it is not the individual which is suffering externally, but also the internal conflicts and everything we have to understand in totality. Then only we can understand why the person is suffering and we can come to the cure. And this cure should be based on the perfect guidelines, what Hahnemann sir has mentioned under the cardinal principle. And as sir would always say, homeopathy is mathematics and nothing works without mathematics. Is it echo right now also? Can you hear me properly?
No, ma'am. No echo.
No echo, ma'am. I can hear properly.
No echo, ma'am.
Sure.
I too can hear properly.
Please carry on.
Okay. So we are based upon, see, nothing works without aphorism, and our lectures of predictive homeopathy are based on the true scientific approach and whatever guidelines Hahnemann sir has mentioned to us. So this is what aphorism number 15 also talks about. Whatever is deranged inside and internally is only visible through the totality of symptoms. And as we all know, body is the language of mind. And that is what Hahnemann sir wanted to tell everyone. We cannot see what is internally present inside the body. We can see the dynamis, that is the vital force, only through the effects which is seen outwardly through the totality of symptoms. That is what we have to see. That is why we say that body is the window of the mind. So every symptom of the patient carries a lot of importance in evaluating the totality of symptom. And whatever the symptom the patient is coming to you, the existing malady constitute a whole. They are one and the same. So whatever is visible externally is happening inside the body. So please understand the language of this mind and body correlation, and therefore mind and body correlation. Everyone, my students ask me, ma'am, why predictive homeopathy gives so much importance to mind and body correlation and how does it help? Does Hahnemann has mentioned it in any aphorism? Yes, I will say yes, in aphorism number 15, he has mentioned that this is the reflection which has to be seen and to be correlated when you are exactly forming the totality and analyzing the patient. So this is what Hahnemann sir has mentioned in aphorism number 16, कि nothing will be happen outside. All the external influences which are there at the outward reflection are nothing but what has happened inside the dynamic force. So things are not visible because they are like some inimical external forces which has hampered the harmony of this health, the dynamic force leading to the disease, and this can be seen through the totality of symptom, which we will understand how to evaluate in PCOD. So totality of symptom not only describes you about individualization, but it also helps you to know the sensitivity and susceptibility of the patient. As of now, we all know there was a natural calamity which happened recently in your area, right, in South, due to which Lazar sir said that we were not able to conduct the session at the optimum time. But everyone will have their own reaction, and that reaction of that individual depends upon the sensitivity of that individual, depends upon the constitution, depends upon the individualistic approach, how we perceive that external inimical force. If we are very positive, we take things in a positive way, we will be in a healthy state of mind and spirit. But if we are hurt, we are affected, we are like not able to fight back that strong inimical force, we get affected through it and we get hurt. The disease helps to understand what is going inside the mind. And as we all know, that homeopathy is the base upon the trinity of science, the mind, body, and spirit. So only predictive homeopathy gets connected to the soul level of a patient. And that soul level of patient can be guided only when you go into depth of understanding what has happened, where has the disease started. Did it start from the symptom where the patient has started, or it has begun right from the womb, or did it start from another generation being transferred to the next generation? So this spiritual power of homeopathy is only covered by predictive homeopathy, and we will see this mind, body, and spiritual connection when we will study PCOD through this lecture. So we all know when we talk about PCOD, we should know what female is. As we all know that we should know what Hahnemann sir has said is we should know about the sick, the person who is suffering. So when you talk about PCOD, we cannot miss the topic to learn to study about what is a female. What is the role of female in this today's society? How is she recognized? Many roles she plays right from the birth to the death. She has to handle multiple responsibilities in today's world. She has her own position. She's being recognized through her value system. So a female, as we all say, is a person as an individual, as a gift to this earth. She's not just a mother. She's not just a living being, but she carries so many roles right from the beginning till the death. She tirelessly works not only for herself, but for her family, for her children. This is what a female is. And you should know the role and responsibility what she carries, not only at her home, not only with her children, but also in the society. And if you have to understand PCOD, we should be able to connect the soul of a female. We should be able to connect the female who is sitting in front of you. Why is she suffering? Where the identity was hampered, where she was not recognized, what roles she wanted to play, what responsibilities she had to shoulder, and is she being valued for whatever she is being given? Now you will tell me, ma'am, where to connect it and how to find it. So all the PCOD cases, friends, the soul of PCOD will depend upon all these points which I have mentioned over here. Nothing leaves untouched. Nothing leaves untouched. Every case, go and find what is the female, where is the femininity which she is fighting with, where is the identity. Is it sexual identity? It is her own identity in that society, in that family, If she is playing the role of a mother, so is she satisfied being a mother? If she's playing a role of a wife, is she being honored as a wife? What struggles she faces all through her life? So, as you all know, a perfect female having a healthy state of mind and body will have a good menstrual cycle, because a good menstrual cycle is nothing but identity which helps a female to be a female. It gives you all the beautiful hormones which help you to grow as a female, giving you not only the physical appearance but also the emotional heart of a female. And those hormones, as you all know, are being labeled as FSH, LH, definitely estrogen and progesterone. And we cannot leave behind the love hormone, that is oxytocin, which is being secreted by the pituitary, and it covers the whole menstrual cycle, which on goes throughout the life. It all starts from the day of menarche and ends to the menopause. But you all know that this primordial follicle, which begins forming the fixed amount, the number is being fixed right from the beginning. The ovary needs to mature. All those processes, they start by the 7 years of life, where the ovarian cycle starts getting stimulated. The menarche hits might be by 12 years or 14 years. But all those symptoms, you start getting secondary sexual characters. They all begin at early childhood. So therefore, when you're taking the history of a PCOD patient, then where to take the mother's history, where to take early childhood history, and where to take the menstrual history. So when you find a case where we correlate all this. So where you find a case of PCOD, so you have to decipher at many levels. At what levels and how to correlate those symptoms practically, and even how to approach these patients, we will come to know. So I'm not going to teach you here menstrual cycle, because I consider that you all are well aware of the whole cycle and the whole process. Just for revision, we should know how to understand female is at what stage of the menstruation. Is she in the luteal phase? She's in a bleeding phase, follicular phase, or an ovulatory phase. So there will be different signs and symptoms which will depict you yes, this is the phase of life the female is passing through, and that will help you. Yes, this is somewhere the turmoil is. If the person tells you I get lot of premenstrual symptoms, if I get lot of bleeding problems, then you should know what hormones are playing role at this point. If it is a follicular phase, I'm not able to ovulate, doctor. I have an anovulatory cycle. These are the terminologies which we commonly hear. Doctor, I'm struggling for my infertility issues. Do you have a medicine for it? Doctor, I have lot of menstrual complaints. I have lot of cramps, lot of pain which is passing through. So how to solve it? How to go ahead with these symptoms? I don't ovulate. Doctor has described that my AMH is very high and my AMH is not coming down. I am not having a normal menstrual cycle. My AMH is so high that my doctor says I'm going into early ovarian failures. So these are the terminologies which we commonly come across. So what PCOD says about is a balance between the male and the female part, the femininity and the masculinity part. When you talk about female, you cannot leave behind the best part of the universe, the partner of being blessed by the universe, the male part. Yes. So when you talk about the male energy, when you talk about the masculinity in this part, you talk about lot of energy, but male is the power. Male is that energy which helps you to balance with the female force. One wonderful thought came to my mind that who decides that a male is to be born and a female is to be born? Is there any system which is guiding this force? Why is it like in this universe, no one is saying that only males are born 100% males and 100% females. No, the proportion, the ratio is being guided by the universe. So you are being born as a male or a female is being decided by the universe. It is not under the control of this man. This is what the future plan is. As you all know, the first copulation, when the first embryo takes place, the first division, the first meiotic division which takes place, decides that the person who is going to be born through the mother's womb is going to be a male child or a female child. So that is the biggest secret of this universal plan, which is not under our hands. So none of us can decide that it has to be a male or a female partner, right? Or a female child. So if a person is struggling for a male child or a female child, then the conflict will go to the level of identity, friends, because male and female are the basic identity creatures of this universe, right? And they are the foundation stone on which this mother earth is revolving. You start this history right from the evolution, and you will see this masculinity and femininity is not only under our human beings, but it is with other creatures also. We as humans are now struggling that we try to play as syphilitic role. We try to change the universal plan, but this is not so with other species. They don't hamper with this male and the female part. That is what we say the duality as an infinity. So they never play a hesitant role or they never interfere with this universal plan. But we as human beings try to play with this role and we go into syphilis. So a female who is born as a female should enjoy the femininity, should love to be a female rather than fighting with the other roles and rather than going to another roles to play. This feminine energy is full of love, full of nature, full of nurture and care, and nourishment is her sole aim. We are born with some aim in this life that we have to give love to others. We have to nurture. This is the biggest blessing the female is being there, that we can give birth to a new life, which is not there with the other half. So being a female, we should know what are our characteristics are. We are very intuitive. You all must be knowing. अरे मुझे तो लगा ही था. I just came to know कि this must be happening. If a person is just looking at me or staring at me with a bad eye, I will now know this is an evil eye and someone is staring with me. That is what comes through intuition. We have the power of healing through the love. Mother, as you all know, as a new science has told that the genes or the mother carries throughout the life some cells of a child which was there in her womb, and therefore there is a lifetime connection between the child and mother. Therefore there is a heart connection. If a mother blesses a child, it will be a complete blessing. A mother comes to know that something is not good. This is all what intuition comes up. She has a gentleness. She's very expressive. She's very extrovert. She has to be vivacious, living the life fully, enjoying her daily course, enjoying her role of being a mother, of being a sister, of being a doctor. She is very emotional, sensitive. As you all know, we are daughters of our father. We can understand the feelings of our parents. We can understand emotions of our patients. We are very flexible. We are yielding, and therefore we can adapt. We are born in one home, but we are being married to another home, giving blessings to both the homes. We have that capacity to nurture in any environment. That is what flexibility is within us. And the contrary to our partner, if we see, they are more logical. Yes, they have good mathematical power. They have good reasoning because they are more dependent on their survival. They are more firm. Since the ages, if you will see, the male part in all the species are very strong. They are very adventurous because their role is to protect the universe. So their role is to give strength. They have rational reasonings to everything what is being defined. So this is what masculinity is. So we have to understand that universe himself, Lord Shiva himself, is being called as Ardhanarishwar because he signifies that there has to be a perfect balance in this universe between masculinity and femininity so that the universe runs into perfect harmony. Anyone who tries to disturb will go into a disease state or will go into syphilis. So Sora is living your femininity, living your belongingness as a female in this universe and enjoying the feminine part of your life. And whereas the disease part will come when this force is being disturbed by any of the causes. So let's go ahead. Now I think the part of femininity is being very clear. Going ahead. So if we try to imbalance, if we try to break any rules what universe has laid, as we all know, homeopathy is based upon nature's law of cure. We are the universal, we are based on the universe laws, as aphorism number 26 says. So if we are following these universal laws, we are under the perfect health, the perfect balance. And if we disrupt it, all those emotions which are hitting us, they are not being resolved and they get buried and they develop in their uglier ways. This is what Sigmund Freud said. All diseases which are reflection at the physical level, as we have seen in aphorism number 16, they are nothing but the outward inimical forces, external forces which has hurt and affected the internal malady of the person. So these emotions need to be understood because they have somewhere got deep rooted inside the body and they have gone buried and they show themselves as a hydra headed in the form of ugly ways. So when we study PCOD, I won't bore you with this pathophysiology part because I know we all are being well trained with it, but just a brush up for those who are very new to it. Some newcomers must be there. So what PCOS and PCOD is based upon are the three triads. First thing is hormonal imbalance, the testosterone, and the insulin resistance. These three trinities have to be there. Then only you can understand that this is a case of PCOS, right? There is a difference between PCOD and PCOS. When you talk about polycystic ovarian syndrome, then you have to talk about the trinity, that is hormonal imbalance, insulin resistance, and the hyperandrogenism. What happens exactly is that when the ovaries, they become, actually, people have not understood this part. Why hyperandrogenism take place or why anovulation takes place. So what happens is the ovaries, they get resistant to the surge of LH and FSH hormone because that is responsible for rupturing the ovum. But what happens is the ovaries become very obstinate at certain level and they start dysfunctioning. They start resisting the action of LH and FSH. So initially you will see that the LH and FSH ratio increases. Why that ratio increases? Because body finds it ki shayad, is it possible that my ovaries, my LH ratio is not sufficient enough and therefore my ovaries are not responding to it. So therefore there is an increased surge of LH and FSH ratio. But over a period of time, the pituitary says, oh my God, the ovaries are not responding at all. And the ovum says, I'm too scared to come out of this world and I don't want to leave this comfort zone. And the cyst starts forming and the resistance keep on increasing. There's an interesting study which shows that liver plays a very important role in developing PCOD. And what role does it play is not only in the lipid metabolism or not only in obesity, but liver produces an enzyme which is called as sex hormone binding globulin. That is a protein. And this protein usually gets binded to testosterone. And what happens in PCOS, interestingly, it's a bond, right? This is a bond between a testosterone and a sex hormone binding globulin. So if I'm very secured, if I feel very happy, I have no anxiety, then my sex hormone binding globulin will be sufficient enough so that all the free testosterone, because as we all know, we have estrogen, progesterone, equally we have testosterone. But what femininity does is try to capture this testosterone and bind it to the sex hormone binding globulin. So this hormone or this enzyme keeps this testosterone level under control. But what happens is, because of some pathology, because of PCOD, this hormone or this enzyme protein which was supposed to be secreted by liver is not being released, and there is inefficient deficiency which comes up. And because of the deficiency, this hormone is set free in this universe, and the testosterone level, they go on increasing in the body. And as you all know, that testosterone is not for femininity, it's for masculinity. So we get all these symptoms of testosterone increase. And then you have definitely when liver plays a very important role, the enzymes are not working, the insulin gets resistant because of the androgen, hyperandrogenism, the insulin fails to act, and because of which the glucose tolerance, obesity comes into play. There is definitely abnormal lipid levels because of increase of free androgens. So as we all know, if this FSH and LH level is high, what will happen? The ovulation will not take place, the ovum will not be released, and if ovum is not released, there is lot of insecurity which comes in the mind, there is lot of fear which comes into the mind, and therefore the person suffers from oligomenorrhea, lot of AMH will be there, increased AMH or low AMH, leading to infertility or early ovarian failures. So this is the reason why a person with PCOS suffers with infertility. As we all know, femininity is the part of to be played by a female, but that comes through the identity. And ovary is identity of a female. And if ovary goes into failure, then what will happen? The hormones which were supposed to secrete by the ovaries, they fail. And therefore, there is an imbalance of progesterone and estrogen, leading to lot of testosterone, and androgens, they increase. The LH, that is the luteinizing hormone, increases, leading to lot other pathological symptoms. So as we all know, the common symptoms of PCOD, every second female today is coming with PCOD. So there is excessive hair, there is weight changes, the females are all goal. There is no perfect shape of 32, 34, 36, nothing like that. There is no face which looks like a female. It's all goal. Loses the femininity look. There is lot of hirsutism, lot of mood changes. They don't respond to the sexual activities. There is loss of libido. There are irregular menstruation. She loses her femininity part. There is lot of insulin resistance, and because of high testosterone level, she becomes more of masculine. And as we all know, if you are a lot of masculine, there is lot of hormonal balances, and you are going against the universal law of nature. So how will you have energy to work? So definitely there will be loss of energy, lot of mood changes, and definitely a disrupt in the natural process of this universe. And a female who is born to give birth to a new life fails to conceive. That is infertility plays inside. So we have symptoms of, definitely you can see this female getting plumpy, lot of dysmenorrhea, oligomenorrhea, missing the periods, lots of hair fall, acne, infertility, hirsutism. These are the very common symptoms. Now, friends, what I wanted to tell you is that though they are the common symptoms, but they are the reflection of they are the outward expression of the internal dynamic vital force which is being disrupted. So never miss these symptoms. Please take an effort of recording detailed don't just stop USG says it's PCOD, end the story and go with the common conflicts. No, please take the note of how the symptoms have started. Was the first symptom is obesity, or it was hirsutism, or was it acne? How does it play an important role? So ovulatory dysfunction will give you lot of amenorrhea. Why I'm telling you, nothing will go waste. Friends, first thing is record what is the presenting symptom of the patient. Is it amenorrhea? Is it irregular bleeding? Is it a missed period? Is it a spotting? Or she has come to you with infertility because of anovulatory cycle. What is the presenting complaint? Again, I'm telling you that will give you a key to the lock of emotional pathology. You must be surprised to see this because this is not being taught till now, not being discussed in many of the lectures. So here I will discuss it, how to correlate. So causes of anovulation, as we all know, ovary and ovum, their identity of an individual, of a female. So anovulation is the first syphilitic symptom which will be graded up. Infertility, yes, syphilitic. Why? Because it is against the mother nature. Anything which is against the Sora, motherhood is Sora. Infertility is against the Sora. So what is against Sora is psychosyphilis. Okay, so the reasons will be hypothalamic and pituitary dysfunction. So as you all know, when hypothalamus and pituitary comes up, so they are the as a layer of disease, if you will describe, they are on the sixth layer, that is the APOD system. So they are very high index. So they will be, if someone is going to high masculinity, using lot of muscular power, that can also affect the ovulatory cycle. So as you all know, what we said is females are not to be adventurous. Females are to be more of nurturing and more of adventure, and sportsman is the quality of male. So anovulation, when it comes up, so that is not the quality what a female is born with. If you are in the menstrual cycle, you have to have an ovulation. Okay? So prolonged stress, definitely endocrine disorders like thyroid, like pituitary issues, they all affect the growth of ovary. Premature ovarian failure, that is all talking about what we are talking about right now is femininity. So they all are the people who do not accept their femininity part. There is identity crisis. So whenever you find an ovulatory cycle, go and hunt for identity of a female. So what will be anovulatory symptoms? Definitely there will be bloating and flatulence. There is decreased sexual quality. The cervical changes will tell you that because of decreased libido, the cervical secretions which have to be there is dry vagina, there are mood swings, there are mild lower abdominal pains, intermittent spotting and brown discharges, and there is increased sensitivity to smell. So that is what, if you have seen females who are taking lot of hormonal pills, they tell you that we have morning sickness, and we are not able to, I have a pukish, I become sensitive to the smell of food, and I have a pukish sensation of, I don't know, whenever the ovulation time comes up, I bloat like I'm going to menstruate right now, and I get very irritable during the menses and before the menses. So they are the indication, yes, there is a hormonal problem. Then the second trinity, when you talk about the symptoms which are coming up because of androgen. Androgen is what? They are the hormones which are again for the identity of the female. They are like what we have estrogen, progesterone in female, we have testosterone in male. So when there is an imbalance between the male and female hormone, hirsutism, acne, alopecia, and increased testosterone leads to lot of acne issues and weight gain. And therefore, there is male kind of baldness we can see in females, which is very common. Losing hair from this part, there is thinning of the hair. The long hair are the indication of femininity, which we lose. And there we get short hair or just extreme hair fall. And we get unwanted hair on unwanted areas. So then the third part which comes up as insulin resistance we have seen. Then first find out ki this patient who has come to you is presenting with which prominent symptom. Is it more of androgen? Is it more of insulin? Or is it more of ovarian cycle? Just don't go and land up like this is ovarian failure only and just ovaries are very important. No, there are everything which has to be taken record because we are fighting with totality of symptoms and we have to understand what picture, the sensitivity of this female which has been come to your table. So weight gain definitely is a symptom of insulin resistance because more of leptin which gets deposited as a fat will make the insulin more resistance. Then you see acanthosis in females. You will see dark pigmentation over the neck, over the shoulders, over the elbows, joints, knuckles. There is lot of pigmentation which comes up, black pigmentation and thickness of the skin. There's lot of munching and craving, irresistible desire for sweet or something, food which they want, abnormal cravings which come up. They are like lethargic, no energy to work. You will tell them, yeah, please do exercises, and they will be like, ma'am, you just give me a call, I'll try to wake up. Actually, I get so much tired and frustrated with the daily course, it is very difficult to get up. They have skin tags and frequent headaches because of disturbed sugar levels. Their energy is down because they have lack of insulin, which is acting as a key to sugars. So what Hahnemann sir has said, now why I have taken this base, because Hahnemann sir says that all the diseases, even the most severe disease can be produced by some disturbance in the vital force, and this disturbance of the vital force can be through the imagination, and if you cure this imagination, the disease can be cured. So any severe disease can be also caused through an imagination. So what imagination is talking about? Is it talking only about something imaginary or fancy or fantasy? No. This imagination is not fancy or fantasy, but this is the deep thought which goes imbibe at the soul level. And it goes not only from the mother, but even it can come from your forefathers, foremothers. They have suffered, and that memory is being transferred to your body. And that imagination, sir would say, they are nothing but the delusion and the delirium which go deep into the subconscious mind. So if it is a syphilitic disease, the cause has to be syphilis. So if this imagination is so deep rooted, the disease is so deep rooted that it is affecting the identity. So as you all know, every action has got equal and opposite reaction. So I would always give an example. If I have to break the sensitivity of a glass, it just needs to be thrown from a certain height. It just needs a hit and the glass is broken into pieces. But if I have to break a wood, I need to chisel it to that level. But if I have to need to break a big mountain, I need that high energy, that atomic force to break into pieces. So if such a disease, which is affecting the identity of the female, the femininity of a female, it can never be some superficial reason. You can never say, yesterday my father scolded me and today my menses are disturbed. No. If it is PCOS, if it is PCOD, they are the most important, precious organ of the body. They are the identity of the female. So some superficial soric cause will never bring such psychosyphilitic pathology. It can produce inflammation. Yes, a soric reason, a superficial emotion can produce sora, but not psychosis and syphilis to this level, not to the level of this higher layer of diseases. So therefore, we have to find out the optimum cause in a case which is sufficient enough to bring a disturbance in the vital force. So that imagination which is there in the thought of the child, that female has to be taken place. So as we all know, conscious mind, which is really superficially available to you, it only describes. but we have to submerge into that iceberg and try to understand what has hampered, what imagination has gone deep. And if you will see, the logical thinking and memory goes to the superficial part. But when you talk about the belief system, the habits, the values, the long-term memory, which we are talking about, that mother has passed that memory to the womb, from the womb to the child, those long-term memory. If I imagine myself that I enjoy being a male, I enjoy being more a female, those imaginations, those high intuitive imaginations are part of the subconscious mind. And friends, those who all practice apart from predictive homeopathy, they just take superficial emotions and they enter the case. Can they break the iceberg? No. Because if you have to break the iceberg of PCOD, you have to submerge down, understand what imagination, what value system has created such a hurdle in the life of a female. So going ahead, as Hahnemann sir and Keynes has said, the imagination and the will and emotion and the intellect, what thinking I have been affected with, what emotions, the feeling of being sad, glad, mad, etc. has affected the growth of a female and how it has affected the willpower. So everything needs to be assessed. So if you are treating a case of female suffering with PCOD, so there is a disbalance. There is a disbalance between masculinity and femininity. A female who is born as a female but fighting for the struggle of identity as a male. So there is lot of conflict which are there deep rooted into the deep subconscious mind. So just a short case. This is a case of a female coming to me with irregular cycles, with intermittent spotting, lot of weight gain, facial hair, mood swings. And she says there is an intense craving for junk food. So we can see here the ovaries are also disturbed. There is intermittent spotting. So definitely hyperandrogenism के भी symptoms दिख रहे हैं. There is facial hair, that is hirsutism, insulin resistance, giving us weight gain. So all symptoms are there. Lot of intense craving for junk food. That is also we have seen in insulin resistance. She was a fair lady with a good height, came with a mother. And mother said ki, I just it was not just a jump to the pregnancy history directly, but the case was very fortunate enough that we could take the whole history by the mother's side, and mother was very quite open to help us to take into the history. So when you see cases with lot of ovarian conflicts or with lot of ovarian dysfunction, please don't miss the pregnancy history, because this PCOD, though the symptoms have come to your table at the age of 24, 25, but the conflicts are deep rooted. Here we can see there is hirsutism. So definitely there is identity crisis also in this case. So what mother said is, she is a Mona Punjabi family, and her husband is always busy outside with the business purposes, and there was no as such emotional bonding between mother and father. Constant conflict between the in-laws that we want male child, and there was a constant pressure because she was being constant discriminated by her co-sister that they delivered a male child as a first child. Now the pressure was on this lady that you have to deliver a female child. No, you have to deliver a male child, which is not in hands of the mother. So what will happen if a lady who is pregnant is being forced to deliver a female child? So therefore, throughout the pregnancy, she used to have the thoughts that whatever child I am having into my womb, God, it should be a male child. But God has its own plan. The child was a female. But what mother was giving to the child, this world is not good for females. You are being insulted the female herself is an enemy to a female. So I request you not to fight and just be a male child and behave like a male child. So universal plan was being breached over here, and the female who is born as a female but had the hormones and neurotransmitters which were being secreted by the mother transferred through the womb, creating a daughter which had all male characteristic. So identity problem was there. And you will see all throughout the life, this female fought for her identity. She was a single child. And she said, my father is in a big business. He doesn't have time for me. I don't remember because we were with him. So we had to constantly travel. I didn't have friends. I was always with his company. And he is a person who would organize these matches and all. So I was being struggling throughout the childhood that I had a company of male children only. So throughout the child, I behaved like a tomboy. I have never seen female friends. I always had boys as my friends. He was so busy, he never had time. I think that he is involved with some other female. I'm very attached to my female for my mother, and I feel that she's suffering with injustice. I feel neglected and forsaken. So the scenario was that early pregnancy, she was being forced for a male child, sorry, and the child became such an obstinate, headstrong child. What femininity says is the girl should be yielding, the girl should be extrovert. And what we are finding over here is just opposite. The girl is obstinate, headstrong, very arrogant. I'll tell you, friends, when she came to my table, she was like this. Mother was speaking and she would just look few words again, and she was like, what bullshit is going down over here? And she was too difficult to open her heart, and she was not expressive what femininity talks about. She was too reserved. So she was being insulted by her dadi because she demanded a male child. So dadi would always compare her with other siblings, because of which she would get offended, and she was a loner and she preferred to be alone. And she was a very angry, a frowny child. And even now, she is very aggressive, angry. She can fight back anytime. She is definitely ambitious, wants to pursue UPSC and MPSC. She has got good memory, but not very hardworking. She says that I'm very creative with designing. But doctor, no one can come to my foot. I will just snap them. I will just snob them. I cannot take anything against my mother. And I frequently fight with my father. And I tell my mother, you should get divorced. This is what the whole scene is. So there is a lot of anger and hatred. There is internal grief because a lot of issues has happened during the childhood. There is aversion to the males. She says, when I see my mother suffering, so I just hate the males and I don't want to go into the marital thing because I think that this is the worst thing in life. I just want to earn money and settle in my life. So this is what the whole case was. So symptoms are reflection of mind, and as we all know, body never lies, and body is language of mind. So this female says, I always wished that I should grow very early so that I can give shelter and protection to my mother, and we are not financially dependent on our father, and we can live our independent life. Only for money, I am there with him. So I just want to run away from this place. And when I was 7 to 8 years, since then I've been telling my mother I should grow very fast so that I can give protection to you and help you earn the livelihood. Friends, as you all see in this case, there is no emotion of femininity. All the emotions are more of masculinity. So that is the reflection what we have seen. Now, as we know that ovary is an identity of a female, the love of motherhood, the love towards the family and children, this is not there in this female. There is a discrepancy. It is not that she has aversion to other sex or something like that, but she has not seen a secured married life. And therefore, she feels that the world is insecure for her. And that insecurity, that hampers the identity of a female. Now, the $1,000,000 question is that how will you connect it to the rubrics now? Yes, ma'am, everyone is talking about emotional pathology. Everyone wants to talk about femininity. Everyone is talking about something which is very precious, very valuable. Hunt it. We do that. But where to land this flight now? So we will take few rubrics and understand how we can connect it. So just remember this case which we have described. So that lady had lot of hormonal issues also. Her LH ratio was very high. She had a normal thyroid profile, but her sonography said that there is more of right ovarian polycysts which are present. There is hirsutism definitely. So there is a conflict which is at the precious and the valuable thing. So when you talk about ovaries, you talk about femininity. You know that a female should be a perfect balanced female, giving characters of beauty and defining the affection and nurture. So this pregnancy history becomes very important when it comes to the ovarian conflicts. So when you see PCOD, when you see PCOS, don't miss this pregnancy history because that will give you an entry point. The anovulatory cycle will give you an entry point. Infertility, if it is there, please go deeper. If the infertility is because of anovulatory cycle or premature ovarian failure, there it's a thumb rule. Again and again, I am repeating, go and take the pregnancy history. I had a female. I had so many cases of infertility where one of the case I do remember that there were 3 females, sisters and daughters. And when I inquired, there was nothing in the history. She got a very good husband. Her upbringing was good. Everything was good. So everything was good. Then where was the conflict which was lying down? So at that time, sir has taught us go to the 3rd generation and 2nd generation history, because the memory which the mother has been taken is being forwarded to the generation to another generation, and that memory is very important because that is the very strong thought. And again, when I inquired this female, the history says that she was being pressurized, she was being tortured by the society that already you have 2 females. So now you cannot give birth to a female. We want anyhow a male child. So she gave birth to a child who was a female structurally, but functionally she failed to be a feminine character. So there was infertility which was primarily there. So there are cases where there is ovarian dysgenesis or ovarian agenesis, where the ovaries, the uterus do not develop, right? So there also don't take any disposition of the child just like that. Go to the mother's history. That is very important. And especially the pregnancy history, first 3 months. And even I would say before the pregnancy. Because the XX and XY, which is the first division which decides it is going to be a male or a female child, is decided at that time. So nothing happens after that. So yes, early childhood, the environment around the mother during the pregnancy also plays an important role. If it is only a problem with the hormonal part, because that is physiology. But when it comes to structure, that is pathology, what sir would say, if it is a structural change, then it has to be early pregnancy or the time period when it is something related to the chromosomal disorders, the Klinefelter syndrome, the Turner syndrome. That is again an identity crisis. Please go to the pregnancy history. Even consider the pregnancy history before the conception, right? So that becomes very important. So premature ovarian failures, primary amenorrhea, primary infertility, everything has a reason from that womb side. So that is importance of pregnancy history, and why I have taken pregnancy history, that you all know. Now, that ovaries fail to mature. If ovaries fail to mature, that is an ovarian failure. What happens is that these ovaries, they do not respond to LH and FSH as we have seen, and what they do is, I don't want to come out of to this world. I just want to stay in this protected environment of this ovary, and I am feeling scared and I don't want to mature myself and leave this comfort zone. And therefore, I'm happy, and as a process, I want to stay back in this ovary, in this shelter, in this my home. Because once I leave this home, the world is unsafe for me. So there's a lot of insecurity which is there. The person feels that I'm too small to mature. Right now, I don't want to grow up. I don't want to grow and face the world. I feel that I'm too small to face this world. So better, let me be in the shelter. Let me be in this home. I feel I am scared. I cannot fight this world. This is what mother has transferred to the child. I am too timid. Throughout the life, my mother-in-law tortured me. My husband tortured me. He used to hit me on my abdomen, but I couldn't fight back. I am too timid to fight back to this society. I feel that this is what I am. I have been striving hard in this society for my personal identity. Am I being cursed as a female? Is it a thing I'm unfortunate enough to be a female? Why there is so much of sexual discrimination? Why there is so much of torture in this world? Better I stay back in this world. So you will see these histories coming up. You will see there is a lot of sexual discrimination which the female has been fighting from the beginning. It can be from generations also. I have uh, many cases where I found it. So this is a crux which I have actually extracted from almost 230 to more than 400 cases which I have seen in this 15 years of my practice. So I see these PCOD cases, they are very immature. If you see lot of follicles which are there, you will see a USG report and you will see the follicles which are arranged in the periphery part. Many follicles you will see in these cases. So there is a lot of insecurity which is there. You will see one of the case where there was a lot of fluid accumulation and the ovarian cyst was too big. So a lot of insecurity which was being accumulated, that was accumulative psychosis leading to syphilis. So definitely the child had to be inquired where she feels insecure, right? So the rubrics which you can find is, we should understand what is a cyst. As I said, they are fluid filled spaces. They give you protection. As you see in hydrocephalus also, you see ascites, you see hydrocephalus, where they want to give safety to the brain. So that is for the protection. As you see in the womb, when the child is in the mother's womb, the amniotic fluid which is there, it helps to give protection and nurture to the child, right? So similarly, this ovary, ovum, which is supposed to be as a mature part of primordial, the graphene follicle needs to mature. The primordial follicle needs to mature as a ovum and get into the outer world, ready to mingle with the other sex. But yes, this ovum is not so much confident to face this world. And you will feel that internally, these females are too inconfident. They have in their subconscious mind lot of lack of confidence, lot of insecurities. They feel, oh my baba, if I go into the outer world, what will happen? Will I be sexually abused? Lot of sexual abusers come up. You will find that in early childhood, when they were 5, 7, they didn't even realize what is bad touch, what is good touch. Those childhood memories. I was being beaten up by my father. I was beaten up by my mother. I didn't knew what was happening inside me. I didn't knew what was happening inside the environment which I was there. But I was really very scared to come out to this world. Whenever I saw the world, I felt that there is no mistake in me, and still I have to face the world. This world is so ruthless. This world is so bad. There is so much animosity. And I am a female. I am too timid. I need lot of love. I need lot of nurture. So I have fear of facing the world. So you see covetousness. You see sexual abuses. So ailments from sexual abuses is also there. The mother was constantly forced to have sexual relationship with the father. He was very alcoholic, and he would just come without taking the consent. He would just do the process, torture the mother. The mother felt most of the time that it is really a sexual abuse which I have faced. So I developed a fear for my opposite partner, and I have that fear, oh my god, my partner will come and I will be again raped in my bed. So that is what the sexual abuse is. It is not only with the partner, but even the emotion. What emotion that mother passes through carries a value. So I feel that I am being neglected. I feel that I am not being valued. I am not being loved. I feel that there is a lot of injustice in the society. I just don't want to see this man because this man has abused me. The girl feels unprotected in her own family, and therefore she feels that animosity opposite sex, and she feels that there is hatred for those people who have offended her. Her own mother becomes an we say now sometimes those who are supposed to protect them, they only abuse them. A female is more unprotected in her own family amongst her cousins and all. So she develops a unknown hatred for these persons because she knows whatever touches she is passing through are bad touch. But she cannot fight back because she doesn't have the courage. Either the society won't help her or the parents will just hide the matter. So she starts developing that fear, that aversion to marriage. She sees so many frequent quarrels in the family, and she feels that what has happened after the marital condition, as happened with our case, we have seen that the female also faced so many conflicts between the parents, and therefore she has taken a decision better not to marry. I will force my mother, even you get separated from my from your partner, and I will take up the responsibility of being a strong female, and I will earn the livelihood not only for you but also for me. So she develops aversion to marriage. So when you see lot of insecurity, you can find these rubrics and you can just enter the case. Lack of confidence, covetousness, they are also the rubrics which describes insecurity. She feels unprotected. She feels unsafe. There is delusion that she will be injured in her own home. She feels that I am very sensitive to injury, to mental and physical both. I am sensitive to jerk, and I know if I go to this outer world, I will be injured. And because of that fear of being injured, I just stay back into this cozy home and environment. Then there is quarrel in the family. So because of that quarrel, I just crave for harmony. Because I a person, I want love, I want protection, I want peace. I want that everyone should give lot of love. And because of this, when I see my world, my parents are constantly barging on my head. They are constantly fighting. So I develop a feeling that there is hatred for this humankind. And I just become a loner. I sit in one corner of my room and I don't want to talk to others. I feel being insulted and humiliated. So better the rubric will be ailments from mortification. I just pray to God that my parents should stop fighting. So all these childhood memory, they go deep into the childhood memories, they go into the subconscious mind, affecting again the identity of the female, giving lot of insecurity. You will see these females, when you talk about family, you talk about home, you know, they are connected to liver, because all the family conflicts, future conflicts, if my parents keep on fighting, I might have to starve. What will get affected is my liver. Lot of stress, lot of quarrels which are happening in the family. So they are constantly abusing each other. And there is lot of hustle and bustle in the family, because of which I have hatred towards this. So I just pray to God for this harmony. So you will see all these conflicts in so many cases of PCOD. Okay? So these conflicts of insecurity, you can directly see and pick up the rubrics also. The remedy relies over there. If a child doesn't want that there should be quarrels, she becomes a natural mute. She just sit in the corner of the home and she's so much attached only to someone. She will cling to her toys and she will talk to her toys, saying that my parents don't love me. They're constantly fighting. No one cares about me. वो बच्चे को, she has developed jealousy, because when she compares herself with other fellows, she sees that her parents give so much of time. In our patient, what has happened? Father was not available only. The mother had to fight for father. And throughout the life she has seen was quarrels in the family. So what she developed was hatred towards her father. And she doesn't want to get connected with him. Right? So this brings lot of insecurity, and this insecurity will definitely lead to insulin resistance, obesity. Yes, because insecurity is psychosis. This psychosis in PCOD is not only psychosis, but it is psychosyphilitic, because this insecurity will ultimately give you infertility, right? So she develops some issues which go deep into the mind. So I don't want to mature. When it comes to maturity, we have already seen insecurity leading to immaturity. I don't want to face the outer world. I want to be into my shell. I want to be protected. So what will be the rubrics? Insecurity, yes. Independent, I don't want to be. I don't want to grow up in this society. I don't want to be called as an independent fellow, because this society is too bad. I don't want to take up the responsibility of being a mother. I don't want to be called as a lady who can handle everything all alone. So I'm too timid. I'm too insecure. I feel very helpless in this situation, because I cannot fight back to anything. This is helplessness, and this rubric is definitely a psychosyphilitic rubric. This has helped me in lot many cases where I could identify the remedy. Then confidence lack of, again this confidence lack of will give you lot of insecurity. See, what sir would say is, don't take a rubric and don't define a miasm only on that rubric. In what situation you are selecting that rubric can go to syphilis also. So this confidence lack of goes so imbibed into the genetic level that the female loses her own identity. She loses that confidence of being a female. So this confidence lack of is not only at the level of courage or at the level of will, but it is the level of identity that I cannot be a female. I don't have that courage to be called as a female. So there comes up as, let me be a child. I don't want to grow. I want to be too small. I don't want to grow up. Let me enjoy. So they become childish. You will see that they don't want to grow up. So you can take this rubric. If you find them with poor intellect, there will be a lot of carbons coming up when you talk about immaturity. And one thing I will tell you, lot of carbons, they give you lot of cyst. Natramure will hardly be found in lot of cyst and overgrowth. But when you talk about childish behavior, confidence, lack of insecurities, lot of carbons will come into picture. You see calcarea carbs, lot of cyst formation. You see Berita carb, lot of cyst formation. You see carbons, they will be in the picture. When you talk about MAC carbs, they are very good in 4-second feeling, that loneliness, and they develop slowly the hormonal issue. They have that loneliness, orphanage-like feeling. That is what we have seen in insecurity. So when you see insecure cases, go and hunt. Is it a MAC case? Is it a case of Magnure? Is it a case of MAC-carb? Or is it some magnesium which is coming up because the child was lonely? Is it a natrum carb who is diligent but a loner, but a very conscientious and a selfless remedy, right? If a helplessness is there, we will see what remedies come up. They are coward eyes. Yes, those people who don't want to face the world, they are really very coward. They have responsibility aversion. Therefore, I don't want to be grown up. Let me be a child. Because if I tell them that I am grown up, they will put shoulder upon me responsibility. And I feel at age of 28 years also, I'm not quite mature enough to handle a child. I'm still a child. This is what today's generation tell me. That ma'am, I don't want to conceive. I'm not prepared to be a mother. Why? Because I feel I cannot take the responsibility of a child. It's a very big responsibility and I've seen my parents struggling for me and I feel that I'm not prepared for it. So this responsibility of aversion can also give you infertility, friends. So in infertility cases, try to probe this. I don't want to take the responsibility because I'm too ambitious right now. I feel that we are not prepared financially so that we can take up responsibility of the parenthood. And this is what we can see also. So I feel that I don't have head. How can I take up this mature world? I don't understand what is happening around me. Mama ne bola, I got married, but I don't understand what marriage is. I don't understand what responsibility is. Mama says and I work. So they are like people who are working like puppet. So you can also take body parts, head belong to others. This is also a rubric of identity. Because they are not working with their own head. And also I said ki why they don't want to leave the world, because one thought can be that they have fear of injury. So in this fear of injury, you will see cases where you can take fear of injury if mother has got lot many previous history of abortions through jerks or a lot of abortion history. So where she develops that even if I will move, I will abort. And I don't want to leave this child, and that fear of injury goes deep down, and this child also becomes very insecure and doesn't want to face the world. So there is rubric for maturity, even fear of injury. Because I feel like Thuja, what Thuja has got the sensitivity is, you will see a lot of PCOS cases. I had a cured case where I prescribed Thuja, where there was a strong history of immaturity since childhood, and the patient came up with torch positive history and a previous history of 6 to 7 abortions. She was a doctor herself. And when I inquired in the early childhood, there was strong history that she would never even fall down in the childhood also. So I prescribed a Thuja 201 dose, and that case got cracked. She delivered a normal female baby, and throughout the pregnancy, there was no complication. Where there was past history of 8 abortions, there was a successful delivery. The rubric which I took was fear of injury, because she felt that she is very fragile, and everywhere that was running in the totality, that she would not come, she would not go, she is a professional, she would not go to practice also, because she felt that if I go to practice, I will abort because I cannot drive. She would ask her husband to leave her, right? So then, now, when you talk about identity, as we all know, identity, when we talked about identity in the initial parts, we talked about femininity, we talked about masculinity. In today's world, we are seeing a lot of females who are becoming a lot of competitiveness, and they want to play the roles of the female, not the role of female, but they want to play as a role of male in the society, and they are competing with the other partner, and they want to behave like a other partner. So they are losing their identity of a female. So this identity is not only part of the ego, but it is also the part of their true identity of a female. Yes, this identity is very important and this is very syphilitic. So as we all see, when it comes to identity, the problem will be amenorrhea, primary ovarian dysfunction, ovarian agenesis, or Turner's disease, Klinefelter syndrome. They all are fighting with identity. Transgenders, yes, they are born as a female, but they don't want to live the life of a female. So what will be the rubrics? Any guesses? So they are fighting with their own identity. They're born as female, but they reject their identity. So they are the people who have confusion of identity. So if you feel such cases where you will find that they don't have, even they will go with lesbians also. This rubric can go with lesbians also, where they want to get identified as other part. So because they have confusion to the identity, this is a very strong syphilitic rubric. This can be taken in insanity, schizophrenia, and also in cases on infertility. This is a very wonderful rubric. I have really used it and worked very good in primary amenorrhea cases also. Confusion of identity as to his duality. That means what? This duality is not very superficial over here, but this duality is duality of universe. The two poles of the universe, the male and the female. So when there's an identity of who am I, sometimes I feel that am I a female? What mother gave me the history was that you are born as a female child by the universe. But just because there was lot of conflict in the society and I gave birth to you with the hormones prominent of testosterone. So though you have the body of a male, but you have body of the female, but mind of a male, or hormones of the male. And therefore, you are very competitive, you are very ambitious, you are masculine, you look like a male, you want to be dressed up like a male. So this goes with all tomboyish females. The mannish rubric. But the mannish rubric has got very less remedies. So you can also think of this rubric as confusion identity to his duality when you see mannishness in females. If you see hirsutism, go for identity. If you see male baldness, go for identity rubrics. You can directly pick up these rubrics because hirsutism is again like male, behaving like a male and looking even like a male. Delusion, identity, errors of person, right? Antagonism herself with again an identity rubric because I myself is fighting with what I am not, right? I want to be known, recognized in this world as a male, but I am born as a female, right? Manage habits of girls. These are all rubrics of identity, okay? So aversion to opposite sex, right? They go with lesbians. Why? Because they have aversion to opposite sex and they are more attracted to their own sex, right? So this will give you lack of identity. Identity crisis will give you features of lot of ambitiousness. They want to fight. They are envious. They are jealous. They want to be very competitive. They lack the identity of what a feminine character is. They become like a lion, not a lioness. Being ambitious is not bad. I will not say that being ambitious is bad and that helps you to lose your femininity, but a female can even be a successful entrepreneur, can be a successful doctor if she helps to balance, she keeps the balance between her professional life and her personal life. If you're departing your responsibilities at the personal end and you're just focusing at the professional ends, that will definitely hamper your identity, right? Then independent general, then delusion again. I have taken this identity rubric that delusion body parts, head belongs to another, because my body is what? Like a female, but my mind is like a male, fighting, courageous, ambitious, more of thrilling, adventurous, and I just have aversion to family and household responsibilities. So I don't want to carry up the household responsibility, therefore sepia suffers. Sepia suffers not only insecurity, but at the end, she gets so tired. She's not being recognized. She's not being appreciated. She feels being neglected. And at the end, she just have hatred and aversion to other sex, and even hatred and aversion to getting mature, right? So she develops lot of melasma because she feels that it is not good. The world is not good for a female. So she starts hating herself. She starts looking at herself that she is very ugly, and that ugliness inside, that rubric can also come over here, that delusion ugly she is. Because what a female is a beautiful person who can attract the other part, other half. And if you will see in the species of birds also, so females are very beautifully colored. They are very beautiful, so that they're shaped like that. But when I'm not being appreciated as a female, I just start hating myself. I start looking at myself as I am ugly. Therefore, my sexual partner is not getting attracted to me. CPR doesn't have sexual aversion from the beginning. She doesn't have sexual aversion or aversion to the partner from the beginning. It's her evolution that she's not being appreciated. She's being neglected. She's being tortured physically. She gets so drained out in her physical course that she doesn't have household help. And in the night, she doesn't get that foreplay or that pleasure out of sex, and eventually she feels that devoid of love, and therefore there is a lot of vaginal uh, dryness in sepia. That is because that then her emotions are being killed and she goes into that phase of indifference. So this is what the evolution of sepia is. So delusion enlarged he is. So this is also where they feel that like platina, like the remedies which have got very high ego, they feel that they are not in this world like females, but they want to dominate others. They want to show that we are the royal queens, not as queen, but they are the kings. So they want to fight back with others. So they want to show others that I am enlarged. So they develop obesity, they become hefty, and they want to show the world that yes, I am very confident, and see, this is what big I am. You cannot just ditch me, or you just cannot go away from me. So that is what psychosis they develop, because they have deep inside insecurity. They want freedom. There is a lot of libertinism in them. So these females, you will see many females, they say, we just want to earn money. I want to live single. I don't want to have females responsibility of bearing a child. My body is not a machine. I'm not here to give birth as a machine. I just don't want, I'm not prepared. The words of the female will not be like this. If you want to take libertinism, the words will be like, I just don't want to get hanged up or hooked up with single male. Or I don't want to hanged up or hooked up with the responsibility. I want my own freedom, and I want to live the life with my own ways. So libertinism will have this hashtag, I want to live without living in relationship. That is also what happens. They prefer going to living in relationship because they don't want responsibility or that hookup which comes with marital responsibilities. They are the females who cannot tolerate injustice. That is what sexual discrimination they have faced from the beginning. Even the mother has faced, or the child on the childhood has faced this discrimination, and therefore they don't want to suffer that injustice, and they just want to fight back with that injustice, and they are fighting with their own identity, because in society they are not being given that respect, that love, that care, that protection what a female demands, and they are being discriminated with the opposite sex at the education level, at home. They don't feel protected, and therefore they cannot tolerate this injustice, and they want to fight back, they want to revolt back to the society, and they become more ambitious, and they want to prove them in the society that you cannot underestimate me, right? So they want to take over what femininity is, and they compete with the male part. So they are the few rubrics with the materia medica differentiation we can take up. As in our case, we have seen the female wanted is, she was fighting with her sexual identity. She said that, mother, since early childhood, I felt that I should grow up and tell my dadi that what you have abused my mother for. See, I am so financially independent, and I just want to grow up as early as possible, so my dependency on my father breaks, and I just can take over the responsibility of this home. So this is what the rubric was there for the patient. So here you will see lot of remedies which are वो बोलते हैं ना, hot blooded remedies like clonine, cannabis, magnesium. They are nuts, or both the nuts are coming over here. So this is where we are fighting with. Even the females, they tell us we want to grow very fast because we want to look good, we want to mature enough, we want to get financially independent, and as early as I get financially independent, I will just have wings to my life, and I just want to fly over. So they feel that why I'm not getting matured very fast. So you will see such things happening in the patient's life. So they have that delusion of being neglected, as we have seen that this child also suffered because her dadi neglected her mother, and since early motherhood, she had to suffer, and she had that crisis. And therefore you will see that remedies like Pulsatilla, who want, they are sick for love. As we have discussed, sepia feels that goes to the subconscious mind, that I'm being neglected, I'm not being loved, I'm not being pampered, and I feel being neglected by my sexual partner. So she goes into, as a reaction to the society, she goes into a shell, and she just goes into indifference. Indifference is the defense of sepia. And if you want to come to the right remedy, friends, just see the reaction of every remedy. Every remedy reaction will be different. A sepia will not cry in front of you. She will be like, मुझे कोई फर्क नहीं पड़ता. I'm not being affected by whatever is happening. I just become lethargic. I don't even care now ki house course is done or not, because I'm so much drained throughout the day. Palladium. Palladium is a very beautiful remedy. Yes, palladium is one of the remedy which comes under spoiled childhood. A remedy which is given to a over pampered. It is just in the series of platina, and a very remedy, platina, palladium, gold, they are in the same series of the chart of periodic table, and they are also over pampered, and they feel that they are like queens, and they behave like, no, if I'm neglected, I just give a heck to others. If girls are neglecting me, I will give heck to them. I will enjoy the company of males. And if females are rejecting me, it's okay. I will behave like a male. So they go into tomboyishness, because it is not because just they are over pampered, but because they feel that their other partner is neglecting them. So this is how Natramure, as we all know, they feel neglected because they go into disappointment of love. So this is how we can differentiate. Confusion of identity has got 49 remedies into it. The most 3-mark remedy is alumina. Alumina as such has got confusion of identity, what is right and what is wrong, right? But alumina as per se will have lot of dryness, lot of constipation which has to be there, and abdominal complaints are there. So alumina can be thought of even in cases of PCOD. You will see lot of calcareas also coming up. Calcarea fos is coming over here. Antimonies are coming over here because of the bitterness. They have so much of confusion that they become so bitter in the society. They become misanthropic. They become malicious. They become very quarrelsome. And you will see lot of antimony because of disappointment. They go into that. Then they have Kali bromes into it. Kali brome is a remedy from the Kali group, which has got lot of delusions. Delusion of all the delusions you will see that Kali brome suffers, because Kali brome has got a deep core sora, as that they feel that they are not worth. They feel that they are not worth in the society. They feel that people are hating them. They feel being neglected. They feel being offended very easily. Lot of delusions are there in Kali brome if you talk about Kali. Then again, Naja is coming over here. Natrums are coming up. Sulfur, Thuja, sickle cord, again a female remedy. Cyclamen, a very beautiful hysterical remedy belonging to the female group, where I have seen lot of joint complaints, hysterical complaints coming up. Think of cyclamen. When you see PCOD with hysterical symptoms, think of cyclamen, because they have lot of depressive symptom also. If you see remedies like cannabis, if you want to prescribe, they have lot of insanity like features into them. Yes, torch positive or gonorrheal infections, recurrent UTI with delusion, then think of cannabis indica. Cannabis sativa, if you come up that they have lot of sexual partners, they had history of STD, genital herpes, something like that, STDs, then do think of cannabis as a remedy. If you see that they are spoiled brat, too pampered, hysterical, and too vivacious to talk, think of Moschus. If they are very fearful, think of Stramonium, right? So this is the way how you can differentiate. Yes, phosphorus, pulsatilla are the cute remedies which will come into this group. But why do they go into confusion of identity? Has to be searched, because every action has got equal and opposite reaction. Duality, sensation of, this is also what we have taken. In baptisia, when you talk of duality, sensation of, this comes up in the state of delirium, because baptisia is the remedy for fevers. And when you talk about baptisia in this state, they, in the fever state, in duality, they feel that someone is lying on the bed on the other side. So that is in the fever part. But baptisia say better, I will think of cyclamen, Moschus. When it comes to PCOD, I will think of lachesis. Yes, a wonderful remedy. For PCOD, I would think of Thuja, because that will be more psychosyphilitic. Soric, no, I will not think of more of soric remedies over here, because again, it is duality. Then identity errors of, we have already discussed. Identity crisis, when it comes with crisis with her own identity of being recognized as a female. Then mannish habits. Yes, they are very short. I said before that it is a very small rubric. So you can really take this part as delusion, identity, errors of, or even confusion of identity. Antagonism with herself. Again, we have discussed. This will give a identity rubric. Child aversion to or aversion to responsibility, because they don't want to conceive and take up responsibility of children. So they hate their children. If they have children and they start hating them, think of sepia, but they don't want to conceive, then think of chocolate. Platina, yes, Platina doesn't want to leave her priceless beauty, what she thinks that I had one patient recently, she came to me that, ma'am, I don't want to give birth, I want to go for surrogacy, because I don't want to lose my precious beauty, and I am not a professional model, but I think I am the most beautiful daughter of my father, and I just don't want to miss with my breast shape and my bust shape, and therefore just give me a remedy so that I become infertile. So what person can think about this? So this is platina, because that high ego that I am so beautiful like a princess, and I cannot live this royalty just because of a child. So I don't want to leave my territory. right? So the platina went to her. Responsibility, aversion to, definitely calcarea. Marble is coming over here, lycopodium, medorinum, and phosphorus. Medorinum you can think of in PCOD because medorinum is again king of psychosis. Lot of STD, yeah, torch cases, torch positive will come up. Confusion, identity, delusion. Sir, I think before I take the second case, if any problem, we can take up. I think this will take another 15 minutes and we are short of time. What the public says, are people there?
Yeah, doctor, please carry on. Please carry on. You can take another 15 or 20 minutes, no issue.
Any questions we can take up? Because it is 10, 15, 10, 10.
Yeah, so if yeah, if questions are there, you can take questions or we can continue. Up to you. Dr. Anda, what is the time limit? What is the slot?
Antagonism with self. Someone wants to know about this rubric. There was another short and sweet. What you want me to do is, should I continue? Antagonism with self is another a beautiful rubric we can think of. Definitely, antagonism comes up when we talk about antagonism is again an identity rubric where she's fighting with her own self. And the first case which I gave, I will share with you the totality and the repertorial presentation because I have taken is that she was being, there was a delusion that she was being neglected by her mother, grandmother. She was discontented, dissatisfied. I took was the rubric was delusion that time passes too slowly and everything seemed longer and she wants to just grow up. I did not prescribe on the basis of obstinate, headstrong, or other things, but definitely the delusion rubric that she was being neglected right from the motherhood, right from the pregnancy. She was an unwanted child and she was a person who did not like injustice. And the remedy which was being prescribed to the girl was palladium. Yes, secondary amenorrhea. Let us take up. Do you want me to continue?
Please
Can
continue,
you please
ma'am.
vote for me?
Please continue,
It's very
ma'am.
difficult to assess. It's a new group for me.
Please continue, ma'am.
I think no one is sleepy. No one has slept. I hope I have not bored the group. I'm new to this presentation. Okay. So this was palladium, which I have prescribed to her because she was very haughty to talk, introvert, and she was very sensitive and she was being pampered by the mother, definitely. And but father side, she was very unhappy and dissatisfied. So this is also a remedy. I just typed discontented to understand what platina can be, palladium can be. So palladium is one of the remedy which is very obstinate also and headstrong also. And as we all know, PCOD children, they become obstinate and headstrong. So let us take a short and sweet another case. Yeah, this is another case of secondary amenorrhea where the patient had come to me that once only she had her menses, and after that it's been almost 1.5 years that she has not got her menses. As her reports say that her endometrial thickness was very thin, and she had polycystic ovaries, and her first menses which was there was a heavy bleeding only for once she had her menses, and now she's 16 years of age with coming with no menses. She has tried all the pills to have menses, but still she did not get her bleed also. So this is a case of secondary amenorrhea rather than calling it as a primary amenorrhea. The more presenting symptoms were acne, pain in lower limbs, lumbago. There was no obesity, right? There was no, yes, there was hair fall, more of acne, more of, so now keep into mind what are the symptoms more important. Then she had amenorrhea. So she looks very small to her age, and she didn't look like a 16-year-old child. She was like a 9 or 10 years old female sitting in front of me. Her height was very less. Mother and father, they also had less height. Father was comparatively better, but her height did not achieve to the normal range also. So mother was also worried. So whenever a case of amenorrhea comes up, please do check for the secondary sexual characters also, because that carries a very important meaning. So past history, she had a past history of cons. She was being prescribed with some other female homeopath who had prescribed her silicia, which did not give her result. She had history of chickenpox. I will take into short. Her pregnancy, mother says ki we are very well-to-do family and we belong to a joint family. But because of some issues, my husband had to shift to Mumbai, and I left the native place of my in-laws. I felt very protected when I was with my in-laws, but when I went to my because I had to stay with my husband who had shifted for business purpose to Mumbai. So I had previous history of abortion, so I was very scared. I was very anxious throughout the pregnancy, and I did not wanted to lose this child. And mother said ki I was always in that anticipatory mode because I felt very lonely and very unprotected when I was in Mumbai, because my in-laws place is very good. My mother-in-law is very caring. I have a very good family environment, and we had to leave that family environment, and I was shifted to Mumbai. And throughout pregnancy, I had that fear ki again if I go out, I might abort this precious child. So this was again something which was very interesting found in the history, that now you can correlate that mother is very anxious, insecure, fearful, and timid, with lack of confidence of facing and handling herself all alone. What she desires is that I should be in a protected environment, right? So this is the correlation, what theory we have practically we have to correlate, right? So she wanted to have a joint family. Even the girl, when we inquired about her disposition, she said that I am a timid, mild, and introvert, very sensitive girl, a delicate looking girl, younger to her age, and she wanted to always stay in a family in a protected environment. That is what even mother had. So she said, Mama, we should go back and we should stay with our native home where all our family members are there, because I enjoy their company and I cannot tease anyone. Even if others are teasing me, I enjoy them. I'm very fearful and anxious. I don't know if I will score good or not. I'm very anxious. I get sick before my exams, and this is what the whole story was going around, right? So she said that I first time when I had my menses, I was really very scared. Because when I got my menses, everyone started talking about ki now you are mature enough. Now you have to behave like a big girl. Now you have to behave like you have to take up the responsibility. She's a over pampered child by her mother, and she likes to cling to her mother. Always, she will hold her hand. Mother will come and bring a glass of water to her, and she would say, "I don't want to have menses because if I get my menses, everyone starts saying ki I'm mature, mature, mature." And I don't want to get mature. And she says that I always had a fight with my brothers and brother, and I don't like males because they keep on fighting back, and I cannot fight with them. And I think my mother is very partial with my brother, and she's more protective towards the brother. And I really get jealous since my brother is also born, and I don't want to just get connected to him because I feel very insecure when my mother is pampering him. And I feel that I'm left alone and my mother doesn't love me. And I keep grumbling behind her that you should take care of me. I don't even take care of my daily chores. मेरा ड्रेस भी मॉर्निंग का शी हैज टू प्रिपेयर शी हैज टू गिव मी अ ब्रश she will take care that she's nearly nagging up behind me ki go and do this do that. So I'm so much dependent upon my mother and my family that I don't want to go out of this house. And I get really angry when my brother teases me that you will get married and you will have to leave this home, and then the mother will be only mine. So I have that fear that I will be separated from my parents, so I don't want to leave this home and go out. My mother is forcing me to go for some higher education to Ahmedabad, which I am disagreeing because I just want to live alone. I cannot even imagine living alone without my parents. My teachers were also very partial, and they always scolded me, insulted me. Though I was a shy and obedient child, I always got hurt, and I was being very afraid of being punished. And I felt lonely because I was a reserved fellow and I did not have that confidence to go and tell my teacher that this is not my mistake and I have not committed anything wrong. So I since beginning, I had that fear of being, fear of boys, of being teased that तू तो बिल्कुल बच्ची है बच्ची है बच्ची है. So everyone would just tease me, and कोई भी आता था सर पे मार के चला जाएगा, बच्चे आएंगे कोई आएगा ऐसे मार के चला जाएगा. तो I get scared and I cannot fight with them. And even teacher would scold me. It was not my mistake, but teacher scolded me even though my friend committed a mistake. So this is what the analysis goes, that she is a slow learner. She has difficulty in maths. She cannot do calculations. She has fear of studies, but she has got a very beautiful and artistic aptitude. Her willpower says that she has got lack of confidence. She's fearful and anxious. She always gets fever before exam. And I think because of all these features, that she is too timid and fearful and anxious before exam, she was being prescribed Cilicia by the previous doctor because she felt that she is diligent. She has confusion and forgets the well-known streets also. So she says, I'm so much dependent on my mother that I cannot even go home alone, and I have that fear. So we see that she is struggling with her identity. She is weak. Physically doesn't want to grow up. She has a low confidence. She doesn't want to face the world. She feels being neglected. I need lot of love, caring, and protection. I feel being neglected and there is injustice in the society, and therefore I have no courage to face the world. I cannot fight back because I'm too timid. I feel insecure when I am alone and need protection. So I get confused and anxious before facing any struggle. Even if it is a small exam, I get anxious and confused. And this is all the mind of what we have understood in PCOD ka evolution. And now you will be able to correlate with me ki why there is no hirsutism in this child, why there is only polycystic ovarian disease, why the child has only acne, not of more masculine features. Can you correlate to me very beautifully now? In this case, we did not see, though it is a case of secondary amenorrhea, the child did not have menses, but still there is no obesity which had come up. there is no hirsutism which had come up, because the identity crisis is not with the femininity part, but more of insecurity. Did you get it? This is crux of the whole lecture, right? So this is how, what she wants. She wants a remedy which needs love and protection, right? So because of love and protection, right from where? From the mother's womb. There is fear of loss, fear of separation, fear that that mother is rude, partial. That is her deep subconscious thought. And she feels that I am very insecure, need protection, I'm too timid, I cannot fight with the world, so I want to be in the shell. Now come on, the remedy is out. So this is anxious, delusion that I am small, fear of injury, fear of separation leading to clinging, disappointment from mother, forsaken feeling, confidence lack of, timid, affectionate, fear of dark, she's fearful, she's artistic, she's non-diligent but obedient child, sensitive to rudeness, weeping, anger and irritability, and suppressed anger. So she's a lean, thin, chilly, thirstless, with perspiration of palms, with high sensitivity. Miasm is psychosis towards syphilis. She needs a sensitivity remedy with perspiration of palms and slow. So if we prescribe her, we want to see, I just clubbed it, though we prescribe on single rubrics, but I just wanted to show you all people how these things can be clubbed up. So we should know what remedies come up when we talk about lot of insecurity. So I just wanted to prove you the whole theory which we have gone through. When you talk about insecurity, what remedies come up? When you talk about identity, what remedies come up? So in this whole case, everything was running around the low of confidence, the lack of confidence and insecurity, fear of being injured, because if I go to the outer world, I won't be able to face the world. She's cowardized. She's with lack of confidence, but definitely a mild remedy which cannot fight back, having a deep insecurity because of the forsaken feeling which she had suffered. She is not so strong to fight with the injustice, but she cannot take the injustice because that is triggering her anger. So the remedies which will come up, yes, you will see the 3 remedies which were being, because Cilicia was prescribed to her previously. The more apt remedy for her will be company desire, forgetful, confusion, which was there in her intellectual capability, the development growth arrested, fearful, homesick, quiet, delusion away from home. This is what the deep-rooted thought she had as a mother during pregnancy, that she is being cast away from the home and she is being left away. And therefore, she has given this instruction to the child, since you are away from the home, you are in an unprotected environment, better to behave like a small child rather than growing up. If you grow up, you have to move out. So the delusion which was deep rooted was, I am small. So carcinosin are very delicate, definitely anxiety family about precocity, which is not seen over here. Cilicia, confidence, and they are diligent, and definitely they are obstinate also. So the remedy which was prescribed on the basis of fear of insecurity, that fear of separation, which leads to confidence, timid to fight back, and alone when. So ovaries want to remain in shell. They want to be protected, don't want to grow, leading to a secondary amenorrhea, because the delusion is, I am too small, I am too immature to come and face the outer world. I don't want to take up the responsibility also. So this is where we prescribed Calcarea Phos 200, 1 dose. Menses appeared in the 2nd month. And after that, she was being given 2nd dose after almost 6 months, when she went to dermat for her acne and other things. This is what her picture was before. And after her treatment, she became a bit confident. Now she is running a very beautiful boutique of paintings, and she is running a good matlab, she's on a very good level where she's an artist, and now she goes even to conduct sessions outside. After Calcarea Falls, she even took the decision and she went to Ahmedabad to complete her course of designing and painting, which she was ready to pursue. She was not ready to pursue before. So what was learning from the case is understanding influence of nature and nurture in development of PCOD, and how insecurities can develop. Lack of confidence will lead to the pathogenesis of PCOD, and how a female struggles through her identity amongst the female and society, and how the psych importance in selecting a right simillimum in the process of cure, and how we can handle the anxiety of a girl and what the role she is being born with in this society, and where she's being blessed to be a female. If we try to explain and counsel these patients the role they are being defined with, then they will go with the mother nature and the disease will be converted into the state of health. So this is the end of my lecture. Lots of gratitude to my guru, Dr. Prafull Vijayakar sir. Thanks to the team coaching to give me this wonderful opportunity to share my thoughts and my experiences. And especially thanks to my senior sir, Dr. Lazar sir. We were there in scph plus, but we hardly had conversations there. But he approached me to go and to join this beautiful Triumph series, where lot many learners are there to motivate me to share my opportunity of right homeopathy and spreading the right thoughts to you all people. Hope I have connected to the basics, and whatever the conflicts a PCOD females passes through, any doubts, any queries, we can take up ahead what the team says as per the demand of the audience and the team organizers. Please let me know. So this is my part. Thank you. Thanks a lot for being patient listener and motivating me. And I hope I have kept you all awake.
Thank you, Dr. Ruchi. It was a nice session. Incidentally,
So
I would
please do
like
give me your reviews, even if it is
yes,
is discussed in your group. Please
yes,
send me
yes,
your
definitely.
feedbacks. I would really try to improve myself wherever it is important, and I would like to discuss more and improvise myself at my end wherever I can improve.
Yes, sure. And incidentally, I would like to tell all my friends that we are opening.
Natrum carb is a remedy which is selfless. Natrum carb is a very highly conscientious remedy from the natrum group who is diligent, but they will also go into the shell once they are offended and they are hurt. But they will never go into revengefulness. They are very decent people, and they are like, they, even if they will go into PCOD, there will be not a crisis of identity so much, but they will more of insecurity remedy. See, if identity comes up, then lot of aggression is coming up. Do think of metals over there, because metals, animal kingdom, they will have all the qualities of identity crisis. When it comes of insecurities, lot of cyst which comes up, do think of remedies from the carbon group, natrum group. They will come up. Pulsatilla, sepia, they all are insecure remedies. But when you talk about lot of ambitiousness, revengefulness, antagonism, think of ophidias also. So should we call it end of the session, sir? Do you want to take ahead with something?
Yeah, just to thank you. That's all.
I have been taking sadhana series lectures since last 4 years. So if you wish to see my lectures, you can join my YouTube channel. In Nagpur, we are conducting with the help of, actually Amravati team is conducting lecture of Dr. Prafull Vijayakar sir. So it's a wonderful opportunity for you all to visit our Orange City and listen to the session of Dr. Prafull Vijayakar sir, who is coming from Mumbai, and he's taking differentiation of practical and experiential materia medica. So you can join us. You can see my lectures on the YouTube channel, and I hope I have satisfied you people. Any further doubts? Spotting followed by heavy menses. What will be the conflict? Okay. So if a female is bleeding so much, so what should be the conflict according to you? It is again a femininity conflict where she cannot take things, because menses is again where the uterus is bleeding. And if it is so much high that it can bring up iron deficiency anemia or anemia to the female, then definitely you can take, if it is very syphilitic, death desire also is a very syphilitic rubric, when the menses are so profuse that she gets anemia because of menses also. So the conflict is definitely a feminine conflict where she wants to nourish the child, or she wanted to, because most of the profuse menses are because of thick endometrium, or endometrium thickness is because of the psychosis, which is because endometrium is known to give nurture, protection, and nutrition to the growing fetus. So endometrium thickness is lot of insecurities regarding the children. Severe dysmenorrhea, again, this is identity conflict. When the female is having, see, dysmenorrhea is what? Dysmenorrhea, you will see what remedies coming for dysmenorrhea. Magnesiums come up, folosins come up, Nux vomica comes up, Nux mostrata comes up. These are the remedies which come for dysmenorrhea or pains. So they are colicky pains. When they are lot of spasms in the uterine cavity, they just want to push away whole bleed, because there can be dysmenorrhea because the bleeding is stopped somewhere, or they have lot of anger issue. So dysmenorrhea in teenage will be lot of anger against themselves. They can have anger because they want libertinism. You can take such rubrics over there. They want that freedom of a male, and when they are being restricted, because now you have started having a menses, so don't do this, don't do that. So a lot of anger conflicts will be there. So dysmenorrhea is more of anger because it is more of spasm. Cramps. So cramps is holding anger. More of muscle tissue involved in dysmenorrhea rather than endometrium. Fibroid and PCOD, again, PCOD, as we all know, what symptoms are presenting. And again, fibroid, I will say, it is intramural, it is submucosal, or it is subserosal. Which kind of fibroid? Fibroid on which location? Again, the way I have deciphered PCOD, the same way you have to decipher fibroid also. Is it in the submucosal layer? Then there will be more of bleeding. Endometrial fibroids, yes, they bleed a lot, but all are giving. Fibroid means growth. Fibroid means psychosis. Fibroid means the muscularis mucosa growing. So they want to give protection. So this is something, lot of deposition. Fibroid is more of deposition rather than there is lot of fibrin excess when you talk about myasm. So fibrin excess will be, again, they want to be very determined and they want to protect their children. In menorrhagia, if menorrhagia in girls can't take nourishing child, ma'am, in that case, how to get conflict? Okay, when it is menorrhagia, that is excess of bleeding. Yes, if it is not a mother, she has not achieved that motherhood, but she can have that feeling of motherhood. She wants that protection, that attachment from her mother. She can be very, very caring. You must have seen females who are very caring for their siblings. They are just like mother. They pamper their children, their siblings like a mother. They have that conflicts, like they are protecting their children only. Endometriosis, psychosyphilitic. Endometriosis hampers the fertility of a female. For Sir has said for endometriosis is, when endometriosis is there, that means extra endometrial tissue apart from the uterine cavity. It can be into the abdomen, into the ovaries, or in the abdominal cavity also, giving you lot of endometrium. So endometrium is for protection, for nurturing. So when it comes to endometriosis, that means she wants to give extra protection. She wants to give extra nourishment to the child. So that is endometriosis. So lot of affection, and that has to be there. But that is syphilitic. Don't take endometriosis as psychotic. It is psychosyphilitic. Search for the endometrium. Why? One more thing is endometriosis is, it is displaced and misplaced. The endometrium is for maturity. Yes, definitely endometrium is required, but it is in a wrong place. So that nurturing feeling is in a wrong place. They feel that they are, you can take rubrics like head belongs to others, because they cannot work from their own. That is misplaced, displaced. So this is why they are called as syphilitic. Not in the right place. So they find themselves not in the right place. Though they are giving that nurture, that protection, but at the end they feel that it is in a wrong place. Either it is extramarital, or even if they are giving a lot of love, but still into a wrong place. Any other question? Team is there to conclude.
Yeah. Thank you very much, Dr. Ruchi. The session was excellent.
Should I conclude the session? Any indications, please?
Good evening, ma'am. Can you hear me?
So as our sir would say, roar and scream and bring homeopathy live. And this is the way he has taught us. I would never go with direct feeding. This is the technique where we have taught how to do fishing rather than giving food to your meals. So I hope I have satisfied sir. Sir must be happy to see the work we are doing as predictive homeopaths and spread the light, the ray of hope, and let other people say and feel that this sun had shined so bright in his days. So we are the torch bearers. We are just the lamps taking ahead all the light he has sparkled upon us. So you also go ahead and sparkle this light and just beat the what darkness which is there in the young generation, and let them know what is the true path of right homeopathy. So let us spread predictive homeopathy to all the students. That is what I would call upon. Thank you. Let's call it end of the day. Lot of blessings from the sir.